Good morning, everyone, and thank you for joining us at this third day of the European AI Week. I am honored to be invited to give the opening keynote at this session, but I don't want to give this keynote alone. I am accompanied by three amazing other speakers that I will present in about a minute. Today's opening keynote is called Convergence in Health Innovation, Uniting Belgium Multidisciplinary Efforts for a Healthier Future. Why did I name the opening keynote like that? In 2022, I heard one recurring message. There are too many initiatives in health innovation in Belgium. And I often disagreed with that, saying there aren't enough and that we should work together into achieving a common goal. And this talk is precisely the moment in which we reflect upon the past year and we see about the year that will be in 2023 and what will happen in the field of AI, tech, data, and innovation as a whole. So when we started AI for Health at AI for Belgium, the goal was to promote a quintuple helix for health, in which healthcare organizations, academia, the policy sector, the industry, and the citizens and patients are collaborating into a more innovative framework. And this we kind of put into motion, and we achieved several objectives in our roadmap. AI for Health achieved especially the contribution to the National Convergence Plan for Artificial Intelligence that was released by State Secretary Mathieu Michel, and to which I fully agree that the objectives are top priority. I will just resume to you what the four main objectives for health are. The first is to use real-time information to plan health needs. The second is to leverage the potential of health data for AI. The third is to increase the adoption of mobile health applications for chronic illnesses. And last, to drive research and development. These objectives did not come alone. These objectives stem, for instance, from our national AI barometer for adoption in hospitals that were released in 2021. And so, as we can see, things are in motion in Belgium, and the right politic mind and strategy is at hand to promote the innovation and to promote AI adoptions in Belgium. So although there were a dynamic with AI for Health, and although there was a lot of initiatives, there were both some barriers and some boosters after the COVID era. What we saw from the barrier side is that healthcare organizations felt the sense of urgency. Urgency because we had too much to deal with from a clinical side. I myself, as a physician, I experienced that there was a gap between my innovation activities and my clinical activities. Somehow I had a difficulty combining the both. There was some fatigue from the healthcare professionals after the COVID era. As you probably know, we suffered from many burnout in the healthcare sector, with many nurses, many physicians not going to work anymore and not returning to work. And so there is a workforce problem ongoing, not only in Belgium, but in Europe as a whole. Overloading work was another barrier that we faced. If we have too much clinical work, then we cannot improve with innovation. With lack of resources that came with the hospitals, and also in the post-COVID era, there was a lack of education opportunities for the people that wanted to get educated into innovation domains in healthcare. So unless of course, people wanted to be stuck with the barriers, there were also some boosters. And the first booster for healthcare organizations was the drive to improve. There was this sense that we had to do better somehow, that after the COVID era, we have to improve the way that we treat patients and we care for citizens. Second, there was an overflow of research. As you may have probably heard, COVID was a time in which scientific publications were boosted in an exponential way, and that scientific output increased. This made a significant improvement on the mindset in hospitals in what the way healthcare organization had to improve, especially in the COVID sector, but it translated to other areas as well. The political readiness increased as we all became aware of the importance of and the centrality of healthcare in our society, even more so than before. And this increased the number of initiatives destined for innovation in healthcare. And last, and this will be the topic of today's session, there were so many ecosystems that emerged for innovation in healthcare. And even if these ecosystems at first were separated, we will see how these initiatives have an extreme convergence. And this will be the core of today's topic. So the 5 areas, healthcare, academia, policy, industry, and citizens, are somehow, even though at first separated by hard silos, coming together. And the initiatives, the ecosystems, are the forces that are driving these 5 domains together, the 5 domains of the quintuple helix. And we will see just how. A first example that I want to give you today is one direct output of the AI for Health initiatives in Belgium, is the chair of AI and digital medicine. So this chair answered the need for medical education to adapt and to adopt artificial intelligence in the curriculum to educate future professionals. The chair of AI and digital medicine was founded at the University of Mons in 2022. And I had the honor of being named chair of the artificial intelligence at the University of Mons with a joint initiative by the university and the Réflexion Medical Network Press that financed the chair and endowed the chair for 5 years. This was an amazing initiative that allowed us to put into place the very first mandatory courses for artificial intelligence integrated into the medical curriculum of medical students at the bachelor's level. But the chair did not stop at that. The mandatory AI course in the bachelor's degree that involved more than 100 students went beyond that, as we offered a digital medicine introduction course for all students and professionals. This digital medicine course is online and can be accessed by any healthcare professional in Belgium. And the goal is to produce 1 series per year. The first series was published last year in 2022. This year we'll see the 2nd season of the digital medicine course, it allowed professionals to follow this course and to be certified for following this course. Those who wanted to go beyond online courses had the chance of following a in-person university certificate of AI in medicine and digital health that we organized at the University of Mons and University of Brussels. The goal was to offer ongoing and working healthcare practitioners to engage into a formal education around AI and digital medicine. And I was very, very happy to see that the certificate was sold out only 1 month after we opened it. Today, there is a long waiting list to get into the certificate, which makes us proud to have put into place such an initiatives. Of course, there will be, and there are already medical doctors, physicians, and other healthcare professionals, and even professionals that aren't originally in health, but want to focus on health, that want to pursue a higher degree, such as a doctorate, a PhD. In this case, we have put into place a specific PhD program into AI and digital medicine that enrolls, as of now, already 4 medical doctors in different areas such as surgery, anesthesia, neuroscience, and psychiatry that are pushing forward the boundaries of health research in the field of AI and digital medicine. I want to talk about an event that happened, of course, and that was released yesterday in the media. We learned, unfortunately, the death of a person that was in contact with a therapeutic chatbot, that a person who had a mental disorder and that committed suicide. Of course, we can rush to conclusions as to the utility and the diabolical side of chatbots, but I don't think that that is the way to go. As a message, we need to remember that artificial intelligence applications need urgently to be validated into clinical practice as we do other kinds of treatment, and we need to take seriously the fact of validating digital solutions in the healthcare space, although we still need to acknowledge the immense potential that these solutions have to revolutionize the way we do healthcare and to help patients and citizens stay in touch with their health. In this case, one of the major roles of the chair of AI in digital medicine is to accompany hospitals that want to improve in the way that they are adopting digital solutions, and therefore to conduct clinical evaluations and clinical studies assessment of these solutions. Okay, so that was more the academic / hospital side of this presentation. I am glad today that there were important initiatives being put in Belgium to facilitate the way that hospitals are adopting digital solution. We know, for instance, that collaboration and the financial sides of a digital project are kind of complicated for hospitals to carry out. And this is why I was very glad to contribute to the Coalition Next Belgium initiative. I want to invite on stage for the first time in the European AI Week, Christophe Jauquet, which is the Coalition Next Belgium lead, and who helped us drive this innovation in Belgium. Christophe, the floor is yours.
Thank you very much, Giovanni. And indeed, so my name is Christophe Jauquet. I will be talking about Coalition Next. And Coalition Next, just to throw it out there immediately, is that our purpose is to accelerate the implementation of digital innovations in Belgian hospitals and home care organizations. My name is Christophe Jauquet, as I was introduced. I primarily work as a keynote speaker on the future of health business, but today I'm here to explain to you what I do as an ecosystem lead for Coalition Next Belgium. To explain to you what it is, I need to go to a company a little bit south of Belgium. I need to go to France because that is where it all started. I also need to take you to March 2020. And I bet you do remember what happened back then. And they always say in these big, important events, you always know where you were. Well, I was actually at home, of course. But what happened is that basically regular care was halted. Patients could not see anymore or could not go to hospitals anymore. They could not see their physicians anymore. And definitely for chronic patients, that caused a big pain. And so what happened in France is that there was an initiative taken, and Giovanni talked about the booster for innovation. Well, this was really a booster for innovation in France, because this initiative called Coalition Next actually gathered a lot of stakeholders. Basically, the quintuple parties were all coming together to work around the same needs, being how can we make sure that regular care is back on the map again in France. And so hospital institutions and mainly life science companies, they were working together with a lot of other stakeholders, mutualities and sick funds, with public institutions, with startups, and even with insurance companies to actually find a solution to this problem that was related to regular care. And so what they did was they identified the needs in the healthcare system. They looked for solutions and they started implementing the solutions to improve regular care, or to have patients have access to regular care again. And what they did was pretty amazing, because in no less than 4 months time, they identified the needs. They evaluated 460 different startups, and they started implementing those solutions in 4 months time, together with 25 life science companies and over 30 hospital institutions. 4 months time. And after 2 years, what we can see is that more than 30 startups were implemented in over 80 hospital institutions in France, which is amazing, of course. And that's why they came to Belgium. That's why they reached out to me to see if I, with my network, can actually start this as well. And so what we did is we launched it in Belgium in April 2022. We did it our way. I talked to quite some hospitals. I talked to quite some life science companies. And what we did immediately was add in the home care organizations as well. Because what we learned from COVID is that we really needed to have this relationship with patients going back home, or treating patients from home as well. And so 1 year later, even only 11 months later, today we are 31 founders that are working together to improve healthcare, to accelerate the implementation of digital innovations in Belgium. These are the different stakeholders, and indeed, Giovanni's hospital is, or the hospital where Giovanni is working is also present in there. What you need to know is that we are not an accelerator. We are not an association with a board of directors and all of that. This is all founded by the 31 companies that you saw on the screen before. And what we do is we go together through an agile process that probably you would do individually, separately in your hospital, in your organization. And that process is pretty basic. It is identifying the needs of the healthcare system. It is finding the solutions and trying to implement those solutions. This is the simple process that we try to put forward. And if I go a little bit deeper into what we've done and what it means exactly, is that we have identified together in the first 3 steps what our mission is. What do we want? Why do we want to work together, right? What do we want to improve in Belgium, in the Belgian healthcare system? And how do we want to achieve this? We meet on a weekly basis, 1 hour. It's a Thursday morning from 9 to 10. And we go through that process step by step. We do small workshops all together with the 31 different stakeholders, and we move forward. We identified a mission, which is as follows, or it goes as follows. It's an open healthcare ecosystem of public and private organizations that combine their expertise in an agile process. That's the process I was talking about. And our purpose is to accelerate a widespread implementation of innovative health solutions that we put in the market together with healthcare providers. Now, of course, you need to have a strategic objective, and immediately it became clear. I thought it would be a really big exercise, but immediately it became clear that the 2 things that everyone wants to work on is patient experience and integrated care. We even drilled it down into specific needs related to prevention and access to healthcare, related to diagnosis and optimizing the treatment pathways, but also to how can we smoothen the process of remote care. We clearly identified those needs, we've written it out, and we put it into a call for projects. And that's when we went into the second phase. We identified the needs, and we were now looking for solutions. We made a call for projects. We sent it out worldwide, but we did active promotions in 4 or 5 different countries. And we got a lot of startups that applied to this call for projects. Actually, we had startups even from the South of America. We had from Switzerland, from Denmark, from Poland, from Israel, from pretty much everywhere. So it's very valuable because we might know quite some startups in Belgium, but it's more valuable to know what are the startups that we can implement tomorrow in Belgium that are not coming from Belgium, of course. And so the whole ecosystem, they were working together to evaluate all the different dossiers that were completed, that were filled in, that were submitted to us. And we evaluated those startups on 3 levels. How do we evaluate the company? How do we evaluate the solution? And then third, which is probably the most important in our case, how ready are they for implementation? Because that is really what we try to do. We are different from any other association or collaboration because we want to have startups that are ready to be implemented. So this implementation part was a really important part in the dossier that were evaluated by the way, all the stakeholders, 31 stakeholders, each brought about 4 or 5 of their colleagues to evaluate these startups. The data, the information that we got on all these different dossiers, on all these different startups, they are categorized, they are summarized in an online database that contains all the solutions, that contains the evaluation, that even contains the decisions. Needs, solutions, and then of course, how can we implement? And this is where we are exact today. First of all, we identified 19 startups that the most of our hospitals, we have 20 hospitals in Belgium, which is 20% of the market, most of the hospitals were interested in. So these 19 startups, they came to present their solutions. During a half hour, they could present, there were questions and answers, etc. And each of our members during that full day could identify which one they would want to work together with, which one they would want to implement in their hospitals. And what you see here is the result of that. And what you can immediately see is that for many solutions, actually half of the solutions had more than 6 or 7 hospital organizations that were interested to implement it. at least every single startup had 2 hospitals that were interested in implementing that solution. So if you're talking about really accelerating the implementation of digital innovations, this is what we did here. Right now, we are putting all the parties together around the table to see how we can make this happen. What is needed to implement? How can we collaborate even together to accelerate this implementation? And of course, sometimes, you know, one startup can work with one hospital, but sometimes, and this is what we are starting to build right now, some startups will work in a collaborative space and will work together with either hospital institutions, home care institutions, or even life science companies or accelerators like EIT Health, for example. This is where we are now. We are really looking forward to see how we can, you know, go from one startup and amplify this success in the Belgian market. Coalition Next is an agile process. This is what I wanted to explain to you today, where we go from needs to solutions to implementations, to accelerate really the process that you are doing internally already, and to do it together to have a bigger impact in the Belgian market. If you are interested in this initiative and you want to join us, don't mind to contact me. My name is Christophe Jauquet, or you can just look up Coalition Next and you'll immediately find my coordinates. I thank you for your attention.
Thank you, dear Christophe, for we can really be proud of this initiative taking place in Belgium, and I had really fun, real fun participating to the meetings and to finally getting to the point where we are actually deploying these applications. Yes, Coalition Next Belgium is a concrete initiative, and I am glad to be part of it. So I also wanted to explore one example from each region of Belgium, and especially looking at Flanders and Wallonia. And starting with Wallonia, I wanted to showcase a specific ecosystem that is born from the Pôle Mécatech, which is a French-speaking organization in Wallonia that is happening and helping hospitals innovate with an innovative solution called the Cosi initiative. I am very glad to invite to stage Caroline Amblay from Pôle Mécatech. I really wanted to invite Caroline to stage. She will be speaking French. Yeah, I thank her very much for presenting the Cosi initiative to our stage. Please, Caroline, the floor is yours.
Thank you, Giovanni. So let's switch in French because it's for Wallonia. So I'm going to speak in French. Donc voilà, je suis Caroline Amblay, je m'occupe du programme Cosi. Donc ce programme est à l'initiative du cabinet du ministre Willy Borsu, et c'est une initiative qui a été donnée au Well Living Lab by Mécatech, qui est vraiment la filière MedTech du pôle Mécatech, donc qui est un pôle de compétitivité wallon en génie mécanique. Et a donc l'objectif de la communauté Cosi, c'est de créer une véritable dynamique autour de l'innovation, des échanges de bonnes pratiques et d'expériences, notamment dans les soins de santé, pour aider à activer la mise en œuvre de cellules et de centres d'innovation et initier et générer des projets d'innovation collaboratifs entre les acteurs des soins de santé et les entreprises MedTech. Parce que le constat, il était où? C'est que beaucoup d'initiatives probantes et de success stories sortent des cartons par la rencontre fortuite à un moment donné d'un praticien et d'un ingénieur, par exemple, et que l'écosystème des soins de santé et l'écosystème des entreprises, des MedTech en général, était assez perméable et qu'il manquait du lien entre ces deux acteurs, et de manière beaucoup plus générale, que les soins de santé n'étaient pas toujours perçus comme un partenaire actif de l'innovation, du moins par les entreprises MedTech. Et donc, le programme visait donc à vraiment faire les leviers et mettre en relation ces deux écosystèmes. Donc, la mission confiée par le cabinet tourne autour de 3 axes. 1, accompagner 3 structures hospitalières dans la création et le déploiement de cellules d'innovation. Donc là, nous accompagnons en région wallonne l'hôpital Épicura, la clinique Saint-Pierre-Ottigny et le CHU de Namur. Et c'est vraiment un accompagnement pour définir leur propre idée de l'innovation, quelles missions ils veulent mettre derrière, quels objectifs, comment l'articuler et surtout comment la structurer au sein de l'hôpital. Puisqu'on s'est rendu compte au travers de beaucoup d'interviews et de rendez-vous que chaque hôpital parlait d'innovation, mais que la maturité et que la structure pour accompagner des projets entrants ou même pour faire émerger des idées n'était pas toujours optimale ou en tout cas à géométrie très variable d'une organisation de soins à l'autre. Donc nous, là, nous accompagnons ces 3 structures hospitalières pour vraiment donner leur définition de l'innovation et de voir comment le structurer en interne chez eux, en accord évidemment avec toute la politique et la stratégie de l'hôpital. Ça, c'est pour l'axe 1. Le deuxième axe, c'est vraiment accompagner des projets d'innovation pour faire émerger des produits de ces cellules, alors de ces 3 hôpitaux, mais également de d'autres en Wallonie. Et donc, c'est vraiment créer, faire émerger l'idée, les accompagner, explorer les besoins, mettre autour de la table les acteurs de l'innovation de manière générale pour voir comment est-ce qu'on peut faire converger les différents écosystèmes, comme Giovanni l'expliquait également, les voir converger et vraiment se réunir, trouver les partenaires pour mettre de manière effective en place les premières idées et les projets qui émergent dans les hôpitaux. Alors, l'axe 3, c'est vraiment une activation d'une communauté. C'est vraiment mettre en lumière chacune des activités en termes d'innovation, que ce soit chez les acteurs des soins de santé ou chez les medtech, mais également mettre en valeur évidemment leur partenariat et le fruit de leur travail et de créer une émulsion autour de ça, de les faire collaborer, que ce soit entre les cellules elles-mêmes au niveau national, mais également pratiquer des échanges de manière internationale, mais se faire rencontrer autour de projets en place ou vraiment les amener à travailler de manière collaborative sur des projets plus transversaux, par exemple. Alors, pour mettre en lumière, visibiliser ces actions, faire interagir ces écosystèmes, Cosi est en train de mettre en place un centre de ressources d'inspiration dédié vraiment à l'innovation sur le web qui va sortir prochainement. Il y a des webinaires, évidemment, avec des partages d'expériences, des ateliers participatifs. On organise des rencontres entre les sociétés medtech et les praticiens, vraiment autour de projets et de produits pour que les praticiens puissent exposer leurs besoins et que l'écosystème medtech vienne voir comment ils peuvent répondre. Et dans la même logique, que tout l'écosystème medtech puisse montrer aux praticiens ce qu'ils ont dans leur carton et voir comment est-ce qu'ils peuvent les tester, les éprouver et travailler chez eux en interne sur le terrain. Des témoignages et des partages d'expériences, bien entendu. On va sortir également un livre blanc où il y a une interview de 9 CIM internationaux au Canada, en Suisse, en France, bien entendu, puisque beaucoup d'inspirations viennent de là, comme on vient de vous l'expliquer également précédemment. Des newsletters, des délégations à WEX sont prévues et évidemment plein d'autres projets prochainement et événements sur le sujet. Donc voilà, c'est vraiment une initiative à échelle, pour le coup, wallonne d'accompagnement vraiment de proximité, notamment avec les hôpitaux, en interaction avec l'écosystème des medtech. Donc voilà, je vais passer la parole à Giovanni et je vous remercie.
Thank you, Caroline, for showing the Cosi initiative. I was also very glad to participate at the very beginning of the initiative into showcasing what the innovation looks like for hospitals and how we can add AI to improve and speed up innovation. And yeah, showcasing that Wallonia is also speeding up things in that process can also be helpful for the entirety of Belgium. The fourth use case that I want to show to you today is the implementation of an international ecosystem of data structuring and data standardization called the OHDSI, or in short, OHDSI. OHDSI is building a Belgian node. First, let me present to you what is OHDSI. OHDSI is an international structure with more than 70 countries that is trying to promote a better structuring of the health data so that it can be used for innovation processes. And as I mentioned, it is a structure that is worldwide and that is now coming to Belgium with the help of several people in academia, with people from the pharmaceutical and life science sector, and people from the tech sector, as well as the hospital sector, of course. This project will help us, of course, speed up the way into which hospitals are communicating with each other in the data that can be structured in a better way. And I want to particularly thank Professor Peters from the University of Hasselt and Dr. Verbies from the University of Antwerp and the University Hospital of Antwerp that are the driving forces of such an innovation in collaboration with the whole ecosystem. This initiative is just starting out, so stay tuned. And if you want to be in touch with this initiative, just keep in touch with the people that are involved. You can just write up OHDSI on the internet and you will find the Belgian initiative. So the fourth use case of today's presentation wants to focus on Flanders. And Flanders has always been at the forefront of innovation in the healthcare sector, both from a business but also academic side. And we as a country have a lot to learn about what is going on there. I want to invite a dear colleague and collaborator, Bart Collet, who has been with AI for Belgium from the very beginning of AI for Health as a board member. Bart is now organizing and leading the Health Innovation School, which is a concept I really like and that is finally coming to Belgium thanks to his dynamic mindset. Bart, thank you, and the floor is yours.
Thank you, Giovanni, for the honor to present here in front of everyone. Thank you so much. Of course, you've all witnessed this scene in Paris, where people are casually having a drink, are enjoying their wines while riots are happening nearby. I think there's an analogy with healthcare, with the situation of healthcare across Europe. We are witnessing here a collapse of a system, and that is happening in healthcare as well. There seems no sense of urgency when people are sipping from their wine, but there's also no sense of urgency because the UK GPs have a very high stress level, where Europe is running out of doctors, not only in the UK, but also in France, also in Flanders, and it hurts healthcare. In the NHS in England, they have a backlog, a waiting list of 7 million people. If you know how many people, how large the population is in the UK, it is 1 in 10 people are on a waiting list. Even the World Health Organization is urging for a time to act and focus on the severe challenges and help more people get into the healthcare profession, not only in hospitals, but also in assisted living and home care, elderly care in general. It is a ticking time bomb. Healthcare is under threat, and we are just witnessing it, and no one is doing anything. But we can change that. I honestly believe that technology and innovation can seriously help alleviate the large burden in healthcare. Tech and innovation can come to the rescue and take the robot out of the human. And certainly AI has a very large opportunity there to alleviate, to lower the burden, certainly with administration, with red tape, bureaucracy, and so on. So healthcare and innovation can have a positive impact in 5 ways. It can improve the service of healthcare delivery. It can improve the outcomes for patients. It can improve the working conditions, so certainly taking away the administrative burden. It can improve the image of the care profession in general, where we can build a better reputation to create more attractive professions in healthcare, and create a more fertile breeding ground for entrepreneurs. So when there is more entrepreneurship, the people from Cosi and from Coalition Next will welcome that there are more people coming into their system. But technology and innovation as such isn't enough. We also need to train our people on the work floor to cope with innovation, to foster innovation, and we need to train them to do so. But unfortunately, current trainings and courses are focused on the management. They have this bachelor after bachelor kind of courses focusing on specific processes in the innovation, but there is no generalist, broad education, very low threshold to enter generalist training for people on the work floor, for entrepreneurial types, healthcare practitioners, but also entrepreneurial carers and patients. So we need a large upskilling effort for that kind of audience. We need to hand over tools and knowledge towards those people on the work floors and those entrepreneurial types, and not only towards the management. We need to create an army of transformers where people learn the basics of healthcare, and where it is accessible to a large crowd that understands what innovation and technology is about. And this is why we have brought the Health Innovation School to Belgium, specifically to organize a course that is very broad and very generalistic, and is aimed at the work floor and entrepreneurial types. And the reason why the Health Innovation School was founded was back in 2017 in the Netherlands, was because those organizations, they face an enormous change in healthcare, not only in technology, but also in expectancy, also in a different way people interact, customers interact with healthcare. And the speed and the complexity and the scale with which this is happening, this transformation is happening, this disruptive change is happening, makes it very difficult for those companies to keep up. And the solution is not working harder, it is working smarter. And the Belgian healthcare system as a whole, but also all the other organizations in that ecosystem, are considering focusing on innovation as a building block for coping with that kind of transformation. And that's the reason why we are organizing this course, bringing the course from the Netherlands to Belgium. And what will the people learn? It is how healthcare works. It is legislation, structure, the bodies involved, but also reimbursement, validation, and so on. Sharing new ways of collaborating and communicating, tools like no-code tools, like AI tools, tips and tricks, and so on. Transforming organizations like process and service thinking, design thinking, implementation strategies, pitching, storytelling, evangelizing, prototyping, and so on. Providing insights regarding business models, something that is lacking in a lot of courses, like the business model canvas value propositions, customer segments, what is a mode, what is an interesting segment to focus on, entrepreneurship, and of course, the latest general trends, not only in technology and innovation, but also about business models and general trends, societal trends that you will have to cope with. It is all very interactive. People work, not only receive the theory, interactive in theory, but they will also have to adapt it with practice in action groups. And it is tailor-fit to the healthcare profession, meaning that there will be a lot of stuff offered on demand when you have a shift that you can't skip, or you have difficulties coming to the school in person, that you can still watch the courses online. What is included in the course is the 5 months intensive innovation program with 6 course days, 4 workshop days, 7 evening webinars, and a final event at which you should pitch your solution that you have worked on in your small group. Everyone has 24 access to the digital learning materials, to the toolkit. There is coaching throughout the entire course, individual and in group, and everyone receives a Health Innovation School survival package. The course starts in September this year. You can scan the QR code into the bottom right, where you can witness a very large and enthusiastic crowd of speakers, excellent speakers and coaches that will help us in this endeavor. The deadline to register is May 1st. We are still looking for sponsors, that is sponsors in kind. That is, if you have a great location, if you want to offer catering, if you want to help pay the bill of certain participants who might have a chronic illness or are a carer and have difficulties paying for it, please contact me. And we're also looking for expansion beyond the Netherlands and beyond Flanders. And please contact me, and let's make healthcare even better than it is today. Thank you very much.
Thank you, Bart. And it is indeed very cool to observe the birth of a new educational opportunity that is comprehensive, that is hands-on, and that can form and educate professionals from bottom up. As a last use case for today's presentation, I want to talk about Digital Wallonia for AI's initiative to fund and finance AI projects in hospital. Digital Wallonia for AI is a solution brought up by the Agence du Numérique in Wallonia that offers 3 separate financing opportunities for hospitals to carry out, and other healthcare organizations to carry out AI projects. These 3 financing opportunities go beyond hospitals and organizations and apply to each organization in Wallonia. And you can either start with small projects with the Start IA package. You can move forward with projects with the Tremplin IA with bigger budgets, and attain the biggest budgets with Digital Wallonia for AI CAP IA initiative. So I wanted to present this initiative because I think it is quite useful for hospitals who are looking for resources, but I prefer to leave it to you to contact the people behind it, Antoine Hublet, program manager, and Emily Fouquet, program manager at Digital Wallonia for AI. Today's presentation could not possibly cover all that it is going on in Belgium in health, innovation, and other domains. Further in the day, for instance, Dr. Thibault Elput will present the Health Data Work Group within the Digital Minds initiative, and I rely on him to present the initiative that we have been carrying out as an ecosystem. The Health Data Agency, brought by brilliant people within the government and outside the government, that has been helping hospital share the data in a sensible and privacy-preserving way for innovation and research. The MedResist project, there will be an initiative today during the European AI Week. There is an event this afternoon coordinated by Professor Benoît Mac at the UC Louvain, who will present the link between industry and healthcare within the MedResist project, the Eden Belgium, and many more initiatives that are making Belgium so strong and so competitive in the field of AI in healthcare, and even beyond data science and innovation as a whole. I really do believe that in 10 years, Belgium will be the land in which health innovation is done. And this will only be possible if there is a convergence of ecosystem. And we see and we are witnessing the alignment of planets, the alignment of ecosystems in health innovation in Belgium. You have witnessed today 3 examples of those. And I want to assure you that, as you may have witnessing, these ecosystems have a lot in common and will likely cooperate and interact in the near future. So let us hope for a convergence of ecosystem that aligns healthcare with pharma, with academia, policy, and tech. We have brought today several examples of such a convergence. But most importantly, if you see that something is missing, if we are missing one opinion, one vision of how healthcare should better innovate, please join us and help us innovate healthcare in Belgium. I thank you for your attention, and I wish you a good European AI Week for the rest of the week. Have a good day.